about now?
No. Yeah.
No?
Let me see.
Okay. All right. Can you hear me? Hello? Okay. All right. We're going to go ahead and do a smile reveal. Will you check and make sure that the audio is good?
Yeah.
Will you someone check on their phone? Okay, guys. So if you're listening right now, we are going to be doing a smile reveal on this gentleman. Can you hear okay?
Yeah.
All right. Awesome. Go ahead and go. Are you live here?
No. No.
Okay. Go ahead and go. Okay, let's grab him. Becky, come too. Okay. Okay, guys. So we are bringing him back right now. And Ravi is going to see his smile for the first time. We're waiting for his family to jump on here as well.
Okay. All right. Oh my God.
Okay.
So many lights here.
My friend, go ahead and take a seat right here.
All right. I'll keep it here.
That's
All right.
great. Hello, how are you?
She can see.
Don't worry, it's okay. You take the seat here. We'll make sure you are all framed up perfectly.
Uh-huh. All right.
Let's see here.
All right. There you go.
Hi, good. You see him. Okay. That'll work.
Mm-hmm.
All right. So, are you nervous?
Yeah, I'm excited.
Excited?
Why nervous?
Okay. So I always ask. Well, before I ask you the questions I always ask, I wanted to ask you. Tell me, where are you at on a scale of pain right now?
Maybe 1 or 2. That's it.
1 or 2 out of 10.
Yeah. Maybe 1. That's still exaggerating.
So
Not
that seems impossible, right? If anyone saw the surgery yesterday, you were bleeding like crazy, right?
Yeah.
Me and Valentina, we had quite a mess to clean up.
Yeah.
So, and there's someone special on the other side. Is this your wife on?
Yes.
And where's she at?
She's in India.
Welcome. We wish you were here.
She wished to see.
All right.
She's coming on 11th.
What was the hardest thing about the procedure? What was the hardest thing about the procedure?
Making a decision.
Making the decision.
Yeah.
And then I think trying to find a caretaker because you were initially going to have your wife here, right?
Yeah. Well, but that's okay. That turned out.
We miss you.
Mm-hmm.
We're glad you're here. So, okay. So, well, let's look at your smile.
All right.
Go ahead and take it off.
All right. Yeah. They have big white teeth.
Wow, look at that.
Nice. How are you finding it, Rachu? It's already a mouthful.
Yeah, you look different.
Yeah, I know.
Get up there. You can go close.
Yeah.
Show her.
Yeah, you look different.
But good, right? In a good sense, huh?
Yeah.
Yeah. Maybe we'll have to make them a little bit smaller next time.
Yes.
Yeah.
Yeah.
We'll do that. No worries.
Yeah. A
Permanent
little bit
fix.
smaller. Yeah.
Yeah.
Okay, so let's look at it side by side here. So this is before.
Mm-hmm.
Here, I'll do that. Can you see here? So first of all, surgically, this is where you were when we first started. Lots of infection, lots of decay, bacteria, and here's your CT with the implants. I think it's one of the most extreme. I mean, you talking remember how like the stabilities on how far you can get in front and back. That's really really great. We got such a great spread.
Mhm.
So your implants are going to be awesome. Okay, look at side by side pictures here. This is your side profile,
Okay.
and look at that. I'll show her. Can you see that? Look at his profile. Look how much different he looks.
Yes, it looks filling.
Yeah, I mean, he looks so much younger, right? Even with all the inflammation. Okay, and then if we take this one off, this is your side by side.
All right.
Look at that.
Bright white. It's just that they're not habitual to see it that way, right?
You don't
Yeah.
think you can handle white teeth?
No, we can handle white teeth. What's wrong with that?
They look good.
Beautiful. It looks really pretty.
Yeah.
You're talking great too. I'm impressed.
Yeah. There's no pain, obviously.
No
I
pain.
can talk.
Yeah. Well, and when the inflammation goes down, it's going
Mhm.
to definitely feel your smile is going to change because a lot of your smile right now is being held up by this swelling.
Okay.
And so when these lips relax, you know how you're saying you felt like there was a lot of teeth.
Mhm.
First of all, everyone says that. Everyone feels that way. But once the inflammation goes down, it'll relax, and then what you're going to find is you're going to have a different smile. It
Okay.
won't look as toothy as it is right now.
I see.
Okay. But if it does, and if you want to change it, we can still change it.
Yeah.
Okay. All right. So I want to show the people on YouTube here our side by sides that are a little better. So let me go to this. Uh-oh. Into the void. So here's some of the pictures that we took of skeletal, because it wasn't just about giving new teeth. It was also making your smile and your face look proportional. And so I think that, your upper jaw was very, very pushed out.
Yeah.
And if we look how much your lower jaw is behind your upper jaw,
Mhm.
and then when you smiled really high, you had a really gummy smile. If we look here,
Yeah.
that's another reason that made it kind of difficult because we had to make sure we hit all that. And so, and then again, if we go side by side, there's the surgery, and then here is the results there. I just love this picture side by side. This is just incredible, right? And all that.
Yeah.
And here's the thing: is you see your white eyes.
Mhm.
These. First of all, they're not actually as white as they seem here.
Okay.
The camera did bleach these out a little bit.
All right.
I give you my word. But that said, your white eyes, because you have a lot lighter eyes than me,
Mhm.
you can pull off a lot lighter shade. And so I'm excited to kind of see. By the time you come back, you'll be more. You'll definitely have more confidence in the shade you want. But I think it looks really nice. Okay, so questions. What questions do you have about your wife too? Does she have any questions?
Yeah, Rachna, you have any questions?
Hello.
Hello? You there?
She went to bed, I guess.
Yeah, yeah.
Yes,
Do you have any questions?
I know what's happening. She's probably yelling at the kids. That's what my wife does when she mutes it.
I heard you.
No, kids are going in bed.
in real, I can, in a position to comment better.
Yeah, yeah. When she'll be here in 2 days. So, but
Well-
you know what? At this point of time, it is. I find it more like mouthful. I'm not able to. I think maybe because of swelling, and again, this portion is still not kind of is in full senses, I believe.
Mm-hmm.
And yeah,
So, I know you're a big YouTube guy. That's how you found me.
yeah.
So ask the people, comment on, and if you think he has too much teeth, because I think a lot of times when you're the observer and you've seen yourself one way,
Right.
for people that haven't seen you, would they think that you have too much teeth showing?
Yeah, yeah.
And I don't know,
There's something odd with
but
this
people
guy.
can comment and kind of say, if they think it looks too toothy.
Right.
Definitely swelling plays into it. I like it. But at the end of the day, it doesn't matter what I like. It's a matter about, you're going to heal on this and we'll come back and we'll get a redo. Only you won't have to go under the knife. So what would you tell patients or people that are on YouTube that are researching, not even about like I don't need this to be like a sponsored ad here. What I'm saying is for people that are looking at doing all-on-4, what were some of the factors? What advice would you give them? You're on day 2 or sorry, day 3. What advice would you give people that are kind of watching or listening?
Yeah. First of all, again, I mean, a lot of times, when we have to deal with like, oh, I have to take out all the TVs and put in some, foreign elements in there and things like that. A lot of times we overthink the things, and mentally we drain ourselves more than the actual procedure itself. So I think one thing is not to overthink, and like keep your focus somewhere else. That way you can let the things happen the way they are supposed to happen. That's one thing. And then another thing, what I think is
So you can see his
sometimes
face.
it's hard to find a good doctor, and sometimes it's we do a whole lot of research, you go all around the places, you weigh in so many other options, price wise, credibility wise, and a lot of experience wise, practice wise, so a lot of things that are to be considered. But one thing I learned is that it's better to find somebody who does one thing 100 times than 100 things one time. And I think that's what attracted me, is that when Dr. Hendrik said that this is the only thing I do, then I know that he is the one who's doing one thing 100 times. So that makes him more knowledgeable. And another thing that I was telling, same thing to, I think, Cindy as well, when you teach others, you are more conscious about what you are telling, because you know the bigger impact out of it. And that's the reason why you tend to learn more before even you can give more. So the more you give, the more you gain eventually. And I know that you run a training as well. I've seen the class, the setup. So that also made me more confident that, hey, you know what, I think Dr. Hendricks knows what he's doing. If he's teaching, I'm sure he will help me out.
I appreciate that. That's some good advice. And I just want to say I appreciate you. And we ended up starting late on the day of surgery. We had our anesthesiologist that got held up on another office.
Yeah. 7 hours. That
But
was
7-hour surgery.
that was, I think, exceptional.
It was exceptional. And I just want to say thank you, because Valentina, you need to come over here, stand for 1 second. Because this gal here, what time did you leave, Valentina?
10:30, I think.
It was like 10:30.
I lost hair, she lost blood.
Yeah.
Also.
I sutured her back up before I started the surgery. That's another good story. We'll tell later.
Yeah.
But also just thanks to the rest of my staff that just stayed late, and also, my mom that was the first person to contact you.
Yeah.
Or you contacted her, Lisa, and Hairsalon. I know where Hairsalon is. Is it lunch or something?
I remember first time there was an online consultation. I didn't get the chance to meet you, but I saw somebody. I don't see them again here, but it was good.
The more you talk with it, the more you relax. I noticed, and this is true with most people, is when you're thinking about smiling, you never smile naturally. If I can catch someone just not thinking about their smile, that actually that's really what we're looking for. And I think we're definitely on the right path. Again, like I said, if this is like chocolate or twist, and maybe you want vanilla, we can definitely make that. But I'm very happy with the result, and we'll see in a few months. So 4 months from now, we'll come back, and let me lecture you. So remember, there's 2 things that you can control: your diet, and what else?
I have to take care of these things.
Hygiene, yeah.
Hygiene.
So diet and hygiene are the 2 things you can control.
Yeah.
Be a good human being. I think that good, karma, kicks in the butt sometimes too. So, don't do bad stuff. But I also just think that just having a good attitude. But if you are on a soft diet, meaning nothing, you're not chewing, you're not grinding anything, no beef jerky, but you're a vegetarian. So I think you're gonna be safe.
Yeah.
But and then as far as cleaning, you're going to use that syringe for the next week and a half, 2 weeks, and then you're going to transition into a water pick.
All right.
And then once a week, you're going to go to church, and that means you're going to go do the actual floss. Okay. Floss is going to church, meaning like once a week you got to go and get in there, and really it's just a tissue massage.
Okay.
Okay.
So I have to go to a nearby doctor and get these things done.
So twice a year you're going to come in.
Okay.
You can come back here, or you can find a doctor there in Dallas, and and we're going to give you all the information. So it's super simple. You just got to find a doctor that has a hygienist that is familiar with these devices.
Okay.
And so, and if they're not familiar, they can come to a course. We'll teach them.
All right.
We'll educate someone from there. But there's a lot of great doctors in Dallas. I'm sure you have no problem. But we will always welcome you back here. I'd love to meet your wife one day too. So
Absolutely. Next time she's gonna come with me, along with the kids.
so remember, timeline wise, in 4 months, we're going to come back. We're going to do testing, and we're going to test the gums and make sure the gums are healed. We're going to look at the implants, make sure the implants are healed, and then we're going to make sure that all the screws are tight. And if you pass all your tests, meaning that you've been on a soft diet, you've cleaned well, then we do our final calculations. And just like we did the day before surgery, we basically come back and we take new scans.
Okay.
And then that's when we're going to write down all the things you want to change. Maybe this long or maybe this long. I don't know. We'll find out. But we're going to make all those changes, and then we'll do a try-in, a printed try-in. We have a chance to see it, talk with it. Hopefully your wife is here and she can see it also.
Yes.
And then if you approve it, then the next 2 visits are in a 1 week period where we do a fitting and then a final delivery. So that's kind of an overview. And but expect to be in these temps for at least 6 months.
Okay.
You know, sometimes it can be more if you disappear on me and go back to India, and I don't know. I'm not sure. Things happen. But until you see me just stay on a soft diet and like I said, be a good human being. Make sure, what's your wife's name again? Rachna, you're in charge. You're my spy. Make sure that you don't let him eat anything naughty, okay?
I'll be on a liquid diet actually.
Thank you. All right. Well, I appreciate you. Do we have any questions that people have? Is there anyone? I feel like you know as much about ALL-ON-4 as me. You did so much homework before you even got there. I didn't have to say a word.
Yeah.
So the implants affect the nerves in the mouth. Do they?
The nerves in the mouth, in the sense, like what? Lost taste or what?
So that's my thing. I don't know what they're asking. So if you're meaning that, do they affect the nerves? If it's done right, the nerves are not affected. Sometimes you can have some inflammation that will cause transient paresthesia, where you're numb for a few days. Sometimes it can last a few weeks.
Okay.
But if you're doing it the right way and you have a CT, we stay away from the nerve. But that's what litigation ends up being, is if you run your implant through a nerve, it's a bad day for everyone, because the patient doesn't have feeling and the doctor is going to go headed to court. So any other questions?
What angle are the distal multi-unit abutments?
Ooh, so we got doctors on here too.
Oh,
Okay, so what were they? I think they're 52 and 45.
Yeah. And I think you at 160 on the top.
Yeah. So you look at that spread on my CT. If I come over here, that's one of the things that's really cool about this case is, you know, if we remember I was telling you about like a chair, anterior, posterior. If we look at how much of a spread we have here, look at this. Yeah, we're on the right one. Take this measurement from here, 23 millimeters on one side and basically 26 on the other. So 26, I mean, that's probably one of the biggest spreads that I've gotten. But the reason why it is like that, and the CT is a tiny bit skewed, but it's simply because I wanted to engage in the floor of the nose and also the sinus. And so someone was commenting on YouTube like how I wasn't using a guide, and I'm like, are you kidding me? I'm you look at where I'm at on those sinuses. I'm within millimeters. I knew exactly where I was. And when you do it enough, I mean, guides are great if you've done it a lot, but if you haven't done a lot, a guide can get you in trouble. Guides fail, so experience doesn't. Okay, well,
I'm making Hendrix is online.
all from Holland. I have family from Holland watching right now. So, hi. Well, do you have anything else? Do you want to say anything else to anyone? Any other advice you thought of while you were sitting here?
No, I think we are good. I know it's a little bit plasticky in flavor. Like, I know it's a synthetic material that is kind of, causing me. I am actually biting on my teeth while even talking. Again, I don't. You can see that I'm not a grinder, but they are like naturally
clacking.
Yeah.
Okay, good. So we're gonna go adjust them. That's great feedback. Okay. So before you leave, we'll go adjust them a little bit to give us a little more space. Okay. That's just one of the indications when
because I'm not able
the back's hitting a little bit further sooner than the other side. Right. So awesome.
Okay.
So
there are some threads type, something plastic material that needs to be cut down.
You got it.
Some
Okay.
other stuff. Yeah.
All right, my friend. Well, you look great. New life.
All right. Yeah. Thank you. Thank you.
You
so
got
much.
it. Thanks for watching, everyone.
Yeah.
And we'll see you soon.
I turn off.
I'm taking too many medicines. Some